Questions 941 to 960. 941. Registered nurse in the intensive care unit performed Glasgow scale assessment on a 50-year-old man who sustained head 24 hours ago. The recorded Glasgow coma score was 10. Which one of the following actions should be taken immediately? Nurse. A. Inform the registered nurse in charge of the nursing. B. Protect the patient by raising the two side rails. C. Inform operation theater for emergency surgery. D. Perform neurologic assessment every 15 minutes. The answer is B. Protect the patient by raising the two side rails. 942. 3-week-old newborn is diagnosed with Hirschsprung disease. Which of the following preoperative care should included in the plan of care? A. Restricting oral intake to clear fluids. B. Administering a tap water enema. C. Inserting a gastrostomy tube. D. Using povidone iodine to prepare the perineum. The answer is A. Restricting oral intake to clear fluids. 943. A 10-year-old child has very limited vocabulary and interaction skills. She has an IQ of 45. She is diagnosed to have mental disease retardation of this classification. A. Profound. B. Mild. C. Moderate. D. Severe. The answer is C. Moderate. 945. A patient who is admitted denies any medication allergies. Medical records state, no known drug allergies. A medic been sent to the pharmacy for gentamicin. The pharmacist record in the pharmacy of an allergy to the medication. Which of the following is the best way for the nurse to do? A. Administer the medication with Benadryl, diphenhydramine. B. Notify the doctor of the allergy and request new orders. C. Investigate further, then call the doctor for clarification. D. Give the medication as ordered by the physician. The answer is B. Notify the doctor of the allergy and request new orders. 946. Which of the following is the best nursing action to ensure safe medication administration? The nurse feels the dosage is unsafe for the patient. A. Call pharmacy. B. Call the head nurse. C. Contact the prescribing doctor. D. Administer half of the dosage. The answer is C. Contact the prescribing doctor. 947. Which of the following consider contraindication of tonsillectomy? A. Child with adenoid infection more than 4 times per year. B. Child with tonsillitis more than 4 times per year. C. Child age less than 3 years old. D. Child with hypertrophied adenoids. The answer is C. Child age less than 3 years old. 948. A 50-year-old woman post-myocardial infarction was admitted in the medical ward. A nurse was assigned to care for the patient. Blood pressure 140/80, heart rate 120, respiratory rate 22, temperature 37.502, saturation 95%. A. Arrhythmias. B. Endocarditis. C. Cardiac failure. D. Cardiogenic shock. The answer is D. Cardiogenic shock. 949. A child has been seizure-free for 2 years. A mother asks the nurse how much longer that the child will need to take the anti-seizure medications. A. Medication can be discontinued at this time. B. The medication dosage can be reduced gradually. C. New medication can be ordered after 1 year. D. Medications can be discontinued after 5 years. The answer is B. The medication dosage can be reduced gradually. 950. A teenage male patient with bipolar disorder is in the psychiatric ward for a week. His speech is incoherent and is complaining vision and hearing problems. Which of the following essential assessment need monitoring and reporting? A. Visual and auditory hallucinations. B. Frequency and span of mood swings. C. Level of agitation and speech difficulty. D. Medication regimen and expected side effects. The answer is B. Frequency and span of mood swings. 951. A child with cerebral palsy was brought to the outpatient department for a monthly follow-up visit. One of the strategies to maximize the growth and development of the child during feeding is to maintain a pleasant and distraction-free environment. Which of the following instruction should be recommended to the mother? A. Serve food that will not stick to the spoon. B. Place the child in a sitting position during eating. C. Encourage child to eat with other children. D. Encourage finger foods that child can handle alone. The answer is B. Place the child in a sitting position during eating. 952. A nurse is preparing to transfer a patient from the operating table to the postoperative bed. The patient had a right total hip arthroplasty. The nurse must maintain the patient hips in the following position: A. Flexion. B. Abduction. C. Extension. D. Adduction. The answer is B. Abduction. 953. A 62-year-old diabetes type IL patient is admitted to the hospital for amputation of the right foot due to gangrene and ischemia. Preoperative, the patient rates the pain as 9 using the 1 to 10 pain scale. How can this patient phantom pain best be controlled? A. Postoperative elevation of the limb. B. Apply pressure bandage to stump. C. Control pain preoperatively. D. Apply ice to the site for 20 minutes. The answer is C. Control pain preoperatively. 954. A diabetic patient on subcutaneous insulin needs to rotate the site of injection to prevent which of the following? A. Insulin intolerance. B. Insensitivity to insulin. C. Increased rate of absorption. D. Hard, painful lumps development. The answer is D. Hard, painful lumps development. 955. A nurse is making an assessment for the manifestation of cyanosis in a dark-skinned client. Which of the following sites is the best for the nurse to check for presence of cyanosis? A. Lips. B. Palms. C. Nail bed. D. Conjunctiva. The answer is A. Lips. 956. A nurse was assessing a newborn undergone circumcision. What is the immediate risk for newborn the nurse to observe? The answer is hypospadias. 957. What the rationale of the initial postpartum assessment of the mother? A. Determine if the uterus is well contracted. B. Monitor amount and color of the lochia. C. Obtain vital signs and determine pain level. D. Determine whether she is physically stable. The answer is C. Obtain vital signs and determine pain level. 958. Position after head trauma? A. Prone. B. Elevate head of bed 30 degree to decrease intracranial pressure. The answer is B. Elevate head of bed 30 degree to decrease intracranial pressure. 959. When a patient tells his nurse, "I need to maintain medication compliance to avoid relapse," and nurse replies, "This correct," which of the following therapeutic communication techniques being used? A. Focusing. B. Exploring. C. Accepting. D. Reflecting. The answer is C. Accepting. 960. Incentive spirometry is? The answer is used to prevent atelectasis after surgery.